Every plastic surgeon in the world today uses a technique called the Indian flap. It's a method of rebuilding a human nose, cutting a precise piece of living skin from the forehead, folding it down and stitching it into place. The West learned this technique in 1794, but it was invented in 600 BCE by a man from Varanasi, India. His name was Sushruta, and what he did 2,600 years ago should be in every school book in the world. Let's put this in perspective. The man the West calls the father of medicine, Hippocrates, was born around 460 BCE. Sushruta was already practicing surgery 150 years before Hippocrates was born. While Greece was still debating whether disease was caused by evil spirits, a surgeon on the banks of the Ganges was performing nose reconstruction, cataract surgery, caesarean sections, hernia repairs, bladder stone removal, and he was teaching it all systematically to a new generation of surgeons. Sushruta lived and worked in the ancient city of Kashi, modern-day Varanasi. He compiled everything he knew into a single text, the Sushruta Samhita, 186 chapters, 1,120 documented illnesses, 700 medicinal plants, 121 different surgical instruments, each designed for a specific procedure, some shaped after the beaks and claws of animals for precise grip. This was not guesswork, this was science. He understood anatomy at a level that should have been impossible for his time. He insisted his students dissect human cadavers at a time when religious law considered touching a dead body a sin. He found a way around it. Submerge the body in water, let it soften for 7 days, then study each layer as it separates. He documented the human bones, muscles, blood vessels, nerves, and the development of the fetus in the womb, all without a microscope, all in 600 BCE. Now, the nose. In ancient India, amputation of the nose was a common punishment for criminals, for prisoners of war, for women falsely accused of adultery. To lose your nose was to lose your dignity forever. Your face became a public mark of shame. You can never re-enter society. Sushruta, however, refused to accept that. He developed a technique so precise, so elegant, that it is still performed today. Measure the missing nose with a leaf. Cut a matching piece of skin from the forehead, keeping one edge attached like a hinge, folded down over the wound. Insert 2 small tubes to shape the nostrils while it heals, and then stitch it into place. And for the pain, he used wine mixed with cannabis to dull the senses. And that's anesthesia for you. 2,600 years before modern surgery adopted it. His knowledge, however, didn't stay in India. In the 8th century, Arab scholars translated the Sushruta Samhita into Arabic. From Arabia, it passed into Persia, from Persia into Egypt. In the 15th century, an Italian surgeon named Gasparo Tagliacozzi published a nose reconstruction technique in Europe. The principle was identical to Sushruta's method. Historians have directly acknowledged it. European plastic surgery, the whole field, is a descendant of one man's work in ancient India. And in 1793, 2 British surgeons in Pune watched a local physician rebuild the nose of a Maratha cart driver whose nose had been cut off by Tipu Sultan's soldiers. They were stunned. They wrote it up. It was published in London's Gentleman's Magazine in October 1794, as if it were a new discovery. It was actually 2,400 years old. Sushruta described the ideal surgeon this way: a person who possesses courage and presence of mind, a tremorless grip of sharp instruments, who carries his operations to the success and advantage of the patient, who has entrusted his life to the surgeon and treats that patient as his own. That was written in 600 BCE. It sounds like a modern surgical oath, right? The world gave us Hippocrates, gave us Galen, gave us Lister and Patcher. India gave the world Sushruta. And somewhere between the translation, the conquest, and the silence, we forgot to say his name. It's about time we remembered.